Hi guys, this is Michelle from Virtual Hand Care, and I've had some people ask me questions about a boxer's fracture. So usually it is because somebody punched something or someone. And what happens is you come in and your small finger gets all this force right onto your knuckle here, and the force transfers right down here to what's called your metacarpal neck. So it's not the head, which this is your metacarpal head, but it actually goes down to the neck and fractures that. So sometimes it can even go down into what we call the metacarpal shaft, and you can get a shaft fracture if maybe like your hand was torqued a little bit differently as you were punching. You can get it other ways too. I've had people fall and get one, and motor vehicle accidents where people gripped onto the steering wheel so tight and then the impact caused a fracture too. But it's called a boxer's fracture. Anyway, so today I thought I'd give you a few tips and things you can do if you're still experiencing some stiffness or pain after a boxer's fracture. Of course, disclaimer, if you are still under the care of a doctor, don't do these exercises. If you still have an active fracture and you're supposed to be in a splint or anything like that, don't do these exercises. But if you're healed and you decided to do some stuff on your own, I just want to give you some quick tips and things you can do. First is to work on your, usually your full fist is difficult to get, and then usually all the way straight is hard to get. You're usually pretty good. Metacarpal fractures, usually you can move pretty good kind of in between, but that full extension, so that full straightening, usually the finger kind of lags a little bit. Or when you make a fist, like you might be making a fist kind of up like this where you can't bend here. So a few quick exercises you can do for that. First, to get full extension is to kind of lay your hand flat. So lay it flat on a table, and what you want to do is try to lift your fingers up and down. So sorry I don't have like a book, but so what I'm doing is lifting up and down. Notice I'm keeping my palm completely flat on my hand, and you just raise it up and down. So you might not notice that the small finger even moves much. That's okay. As long as you're trying to get that muscle to pull straight up, you'll get it strong to lift up. The other thing too is that you can help by pushing it straight. So push it straight up and then try to leave it there. And it might go, it might drop back down. That's okay. Lift it back up, hold it there, and keep doing that a couple times, working on that extension. Now, working on flexion, some simple exercises to get that knuckle going is what I like to call little tabletop exercise. So again, you're clearing the crease. So see this crease right down here in your palm. If you come up too high, you're going to block that. So come below the crease, and what you want to do is come down into just the knuckles bending. Now you don't have, sometimes people say they feel a lot of cramping with this exercise, so don't feel like don't force it. So if like you can only go to here, that's okay, but slowly try to come down farther and farther, just bending at the knuckle. So you're doing that one. And then from there, what you can try to do is to come down into more of a fist and back up to that tabletop and back down and back up and down, and eventually get to where you are coming down and then tucking in. So you're getting this tuck. So you want to see the knuckle, all three joints. So this is your MP, this is your PIP, and this is your DIP. You want to see all three of those joints bend. Now, if you can't get that down, use your other hand to help. So push it down, and sometimes people have to kind of hold it like this so they can see, or do it in front of a mirror so you can see and make sure that your knuckle is going down into a good, 80 degree, 85, depending on what you have on the other side. If it wasn't too bad of an injury, you should be able to get good motion going back with it. So push it down, hold it there with your other hand, and then try to bend too, coming down into the hand and down. Good. So tabletop this way, so having your hand flat on a surface, on a book or table, and then trying to lift up to try to get extension going. Okay. You can also try to straighten it and hold, straighten it and hold 10 times. Okay. Then for bending at the knuckle, go below that crease. Don't go too high or you'll block it. Below the crease, a different kind of a tabletop exercise. They call it tabletop, but bending at the knuckle that way. Then come up on the top and help it come down, and then come down into that full fist this way as well, not letting it pop up. So try those a couple times a day. If you do them at least 3 or 4 times a day consistently for a few days, you will notice a difference. Hope that helps, and keep watching.